Good morning. We will record this small video on fracture calcaneum. We will explain the Essex-Lopresti classification and which fractures you can treat conservatively, where you have to do axial pinning, and where you have to correct the depression of the subtaloid joint and plate and graft it. And if there is a subtaloid arthrodesis, if there is a subtaloid arthritis, you have to treat it by extra-articular fusion of the subtaloid joint. If we draw the calcaneum, this is the calcaneum. Here is the tuber and the cruciate angle, and this is the anterior portion of the calcaneum. In the cruciate and the tuber angle is placed the talus. Here is the sustentaculum tali and here is the navicular. This ligament here is the spring ligament, and here is the cuneiform and the metatarsal. The phalanx. Now the forces that can cause a fracture of the calcaneum are either vertical, this is called as type A, or like this, on this perpendicular to the subtaloid joint. This is type B. So the first fracture that occurs is across this talus wedges into the calcaneum, causing a vertical fracture like this. This is type 1. Then the second fracture that occurs is a horizontal fracture. This is type 2A, or a tongue-shaped fracture because of these backward directed forces. And this tongue-shaped is 2B. In the third stage, there is dislocation or displacement. There are two types of displacement. One is that the posterior fragment rotates like this and becomes like this. So the cruciate angle will increase and the tuber angle will decrease. Cruciate angle will decrease and tuber angle will increase. The calcaneum has now become horizontal. So the cruciate angle has increased and the tuber angle, this is the tuber angle, has increased and the cruciate angle has decreased. So this opening of the wedge of this vertical fracture in the inferior end is called as angulation displacement. And the fourth type of displacement is that this subtaloid joint, as a result of these forces, is depressed, is now here. Instead of this has displaced this much, it has come down. So there is depression of the posterior part of the subtaloid joint. So this classification, where the displacement is either angulation or depression, is called as Essex-Lopresti classification. So there is fall from height, the calcaneum strikes the ground, there can, if it is in dorsiflexion, there are these horizontal forces. If the foot and the forefoot strike together, then there is the vertical force, the B and the A type of mechanisms. First is a vertical fracture, second is a horizontal fracture or a tongue-shaped fracture, and third is displacement, and the displacement can be angulation or depression. After understanding this, so undisplaced fractures have to be treated by conservative means, by plaster, weight relieving till union is sound, and then gradual weight bearing and physiotherapy. And physiotherapy to treat the post-plaster stiffness. Or pain. Supposing the fracture is displaced, so this angulation is corrected by a pin which is passed up to here, parallel to this surface, then moved in this direction, and then passed upwards. This is called as axial pinning. The depression is that you approach below the, supposing this is depressed up to this level, you approach below this, elevate it, and the gap is filled by a bone graft and retained by a plate. In this depression, you have to maintain the correction. You can maintain the correction by plating. The calcaneum is exposed laterally, and since the supply of the skin lateral to the calcaneum is by an end artery, which is the peroneal artery, you have to make a specialized approach to save this peroneal artery. So this is the treatment and classification of fracture calcaneum. To summarize, treat the undisplaced conservatively. Then, if there is an angulation, you treat it by axial pinning. If there is depression of the subtaloid joint, you treat it by elevation, and you retain the elevation by bone grafting or a plate. Of course, you remember that when you are putting a plate, the skin has to be saved from ischemia because of an end artery. And if there is subtaloid arthritis, you treat it by subtaloid extra articular fusion that can be posterior or in the sinus tarsi.